The one thing that we know that works is exercise.
We actually did a podcast a couple of years ago and with a musculoskeletal therapist, and he talked about how a lot of people will come to him with a pain in their back or a pain in a part of their body, and obviously the patient's first thought is, I need this fixed, but he always sits back and speaks to them. Okay, talk to me about your life. Are you having financial issues? Have you got family issues? Have you been fighting with your partner for a long period of time? Because he said what he finds is when you begin to look at someone from a holistic point of view and you learn to understand different parts of their life, that can have then a knock-on effect on how their body. For example, if you're struggling in a financial aspect of your life for a long period of time, you're going to be tense. Your body's going to be tense, and then that's just going to flow down and then cause some sort of back pain. Obviously, there's a bit of him obviously having to do physical work on them, but he says a large part of it is also trying to help them figure out what their day-to-day life is that could potentially be a knock-on effect on that. Would you find like that is an important part when it comes to your research? We need to figure out what people are doing day-to-day to actually maybe even cause these back pains?
Absolutely. So we know that your psychological status will influence on your progression or back pain progression.
For sure.
So whether you're going to get better sooner or later, or even how much pain you perceive. Not necessarily a cause, but definitely it does interfere in how you perceive your pain. And not only that, we know as well that sleep, for example, if you don't sleep well, you're more likely to perceive your back pain, to notice that you have pain in your back. And the other way around, the more pain in the back that you have, the less well sleep.
Just like a constant circle.
Exactly. So all of that. So if a clinician can actually break that cycle somehow, that would be really useful.
And what would you suggest to someone to do on a day-to-day basis in order to ensure that they maybe decrease their likelihood of developing chronic back pain? Someone that maybe doesn't know anything about this, what would you suggest to them?
The one thing that we know that works is exercise. That's it, physical activity. And by physical activity, I don't mean that you have to run 30 minutes every day. So there are the guidelines and the specify how much exercise you need for your general health. But you do need to exercise, go for a walk. Standing or sitting for too long or lying for too long, staying in the same position for too long, that's not good for your general health, and that's not good for your spine. So exercise, light, moderate or intense, but do exercise.
100%.